Hello, congratulations for making it to the final lesson of the Mindfulness Practices for Pain program. The purpose of this program was to introduce you to the tool of mindfulness for managing pain before and after your surgery. The goal of this program was to teach you ways to add mindfulness into your daily routine before and well beyond your surgical experience at MMC. This final practice is yet another opportunity for strengthening your noticing skills. Like all of the previous lessons, this is the tool you can use anytime, and I encourage you to come back to it as often as you'd like. So we've learned in this program ways to shift our focus to our breath when our minds wander. We've practiced moving our attention to various places within our body. We've also learned to use our imagination to create a peaceful and relaxing place in our minds. And we've observed the healing and changing process within our bodies immediately after and several weeks beyond our surgery. As you've strengthened your noticing skills, you may have also learned to relate differently to the sensations you feel as your body heals. You may have even developed a new understanding and a new response to discomfort or different sensations you might feel elsewhere in your body. So perhaps it's 3 or 4 weeks now since your surgery. You might notice that with each week, there seems to be more changes and more healing occurring. Perhaps you notice something new or an unfamiliar discomfort in your body. You may also notice your mind sometimes resist what's going on in your body. You might not like what you feel. You might try to push it away and even label it as a change you don't want to feel. This would be a normal reaction and doesn't need to be judged by your mind. Instead, you can observe what's going on in your body with more of a curious mind. Through these mindfulness practices, you may have gained a new tool for responding to pain or discomfort. You may have learned to open yourself up to it and even welcome it, knowing that you can learn something from it. At some point along the way, you might have even felt a sense of appreciation for the pain, knowing that it was a normal part of your healing process. You may notice, too, the differences between your pain now and your pain before your surgery. What you've done through your noticing practice is develop a new relationship with your pain. So this final practice is another tool to use when pain or discomfort arise well beyond your surgery. This tool is also useful for responding to whatever else may come up for you, even months or years down the road. So let's begin by, again, settling into a comfortable sitting position, positioning your body comfortably in a chair with your back straight and relaxed, or again, lying down, whichever is your preference. And when you're ready, I invite you to gently close your eyes. As you begin to relax your body, bring your attention again to your breath. Become aware of your belly rising and falling as you breathe. See if you can follow your breath for the entire duration of it coming into and leaving your body. Notice the rhythm of your breath and how your body flows with it. And notice, too, the pause between each breath. Remember, just like in other practices, your mind may begin to wander away from your breath and onto other thoughts or images. When you notice your mind wandering in this practice, simply acknowledge this and bring yourself back to the anchor of your breathing. Now, see if you can move your awareness to your body. Become aware of any sensations that may be present for you. Do you notice where in your body you notice feelings of relaxation and ease? Do you notice any tension in your body? Can you notice where other sensations in your body are located? Without trying to change anything about what you feel, just notice it. Notice too that all sensations or experiences of pain, discomfort, or even comfort that you might feel within your body, they're all temporary. Notice that how they feel may change from moment to moment. If you look back over the course of your healing since your surgery, you might recognize the progress you've made. You might recall the times when your pain seemed unbearable, as well as the times it felt more tolerable. You may also recognize that the ongoing pain you felt before your surgery did eventually fade away. You may also notice something else. When you pay closer attention to the pain or difficult sensations in your body, they may rise or change in intensity. If you stay with the pain, if you allow it and don't react to it, it will eventually come back down again. You can see that the more you've been able to stay with your pain, the more you've been able to accept it. Over the course of these past weeks, you may have learned how to allow your pain. Notice what it's like to simply pause and allow something uncomfortable or whatever else might be present for you. Allowing doesn't mean giving into it and being taken over by your pain. Allowing means you acknowledge what's happening in the moment and you lean into it rather than struggle against it. It means that the more you practice allowing, the more you notice that both pleasant and unpleasant experiences are useful experiences that can teach you something about yourself. You've developed a new way to respond to your pain. You've learned to stay with it and to observe any sensation, even the difficult ones, with a curious mind from a distance. When you've created space from the difficult feeling or sensation, you can see that you are the observer to this pain and not the pain itself. Can you see now that the pain or sensations you felt are a temporary state of being and not who you are? Can you accept what feels difficult? Can you let it be without having to change it? Can you make peace with it? Notice what it's like to simply pause and to allow the sensations to be there, rather than attempt to push them away. Although you've had moments of pain being unwanted and difficult to tolerate, can you view your pain with this new level of acceptance? Can you accept the way you are feeling right now and allow your body and mind to just be? You've observed yourself reacting to your pain, the familiar or the unfamiliar feelings you have in your body. You've noticed how you've reacted to it in the past. Perhaps you've tried to push it away or resist it. Now you know that you can simply notice it and make space for it. You've come to realize that resistance to your pain doesn't eliminate it. You've learned that it's not the pain itself that is the most challenging to us. It's our reaction and our pushing against the pain that can worsen it. When you allow yourself this pause to observe your pain, you give yourself a new choice as to how you respond to it, knowing too that all experiences of pain or discomfort are temporary. Notice how it feels to be more welcoming and accepting of any sensation that arises, even if it feels uncomfortable. Now notice if your mind has wandered away from this practice, like it often will, and notice if you find yourself paying attention to thoughts, stories, anticipations of the future, or thoughts of the past. Notice if you sense yourself worrying or wondering about something other than this moment. And again, when you notice this, it's a good thing. Simply acknowledge your mind and bring your attention back once again to your breath. And as we bring this practice to a close, consider again taking a few more deep cleansing breaths, noticing your body breathing. And when you're ready, bring yourself back to this moment, the room you're in, and gently open your eyes.